It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, Ascend Indiana, an organization that creates ways to train and retrain talent in Indiana, has scored some major funding. Barbara Lewis has more in the Business of Health. Barb?
Gary, thank you very much. Well, Ascend Indiana received $2.4 million in funding from Lilly Endowment and the Nina Mason Pulliam Charitable Trust. The organization will use the boost to create a program for behavioral health that focuses on opioid addiction treatment and also addresses the critical nursing shortage. So joining me is Ascend Indiana's president and CEO, Jason Kloth, and Beth Sims, director of the Nursing Academy at Community Health Network. And it's good to have you both back on the show.
Thank you so much.
So it's been a busy 1.5 years for you, Jason. So tell us a little bit about how you're going to use this funding.
Well, first, I just want to thank the Lilly Endowment, Nina Mason Pulliam Charitable Trust, and our corporate sponsors for all of the support of Ascend and helping us get up off the ground. But the reason that we exist is the gap between open jobs and available talent in Indiana continues to widen. And that gap comes at a profound cost to individuals, families, our community more broadly. And so we really aim to close that gap. So the vision for Ascend is for every employer to have access to the talent they need to thrive and to grow their businesses, and for every person to be able to pursue a meaningful, self-sustaining career. And we do that in 3 ways. The first is called the Ascend Network. We will work alongside employers to understand their early in career talent needs, and then identify and connect talent to those internship and job opportunities. Secondly, when there's not enough supply to meet the demand amongst employers, we will actually work as an intermediary between higher ed and employers to build causally new talent pipelines directly into the business. And then finally, we take everything that we learn to inform research and public policy. So for instance, we worked alongside Mayor Hogsett and his team in the development of India Achieves, which will have a profound impact on Marion County students and increasing opportunities for them to go to Ivy Tech and IUPUI tuition-free.
And so, Beth, you were the first to use this custom talent pipeline, as it's called. So let's talk a little bit about the Nursing Academy and what you're doing with opioids.
Yeah, sure. So the Nursing Academy is a very unique, innovative way of educating, training, and preparing nurses for the workforce. And the Community Health Network partnered with Ascend and the University of Indianapolis to really launch this academy model. And Ascend was phenomenal in helping both our partners here to formulate a strategic plan, and that strategic plan is what has made us so successful today in doubling our enrollment and seeing our graduates enter our workforce extremely prepared for the professional practice of nursing and being retained within the organization. And it's a win-win-win for everyone. The students receive scholarship support to offset tuition expenses. The university has a new pipeline of enrollment for interested nursing students, and community has a solid, stable pipeline for our workforce in nursing. And with that success, it is spreading to the behavioral health side, and gosh, it's going to be so beneficial to those who currently are facing addiction issues. The pipeline for licensed social work employees will support more than 3,000 new patients who need treatment for opioid addictions.
And then so, Jason, quickly back to you for one last question here about this network, this brand new network. You touched on it in your first answer. Can you tell us a little bit more about it since it is so new?
Yeah, sure. So the Ascend Network is really aims to be the place where early in career talent go to find jobs and where employers go to find early in career talent. And so to do that, we profile companies, teams, and jobs. And then we break those jobs down into discrete pieces of information: character traits, technical skill, work style. So we have 77 employers in the pilot year of this effort. So we're incredibly excited about that. Then we work alongside higher education institutions. We pre-qualify candidates. We have more than 12,000 in our system to date. We've met with a few thousand, invite them in to create profiles. And then we use an algorithm to match those candidates to those job opportunities in a strategic way. And so we're excited that in the first 8 months, we've placed nearly 397 individuals to opportunities in the hopes of scaling that to thousands in the coming years.
All right, well, that's all we have time for. We have a lot more questions, but no time to ask them. So thank you both, and best wishes for more success.
Thank you so much for having us.
Gary, back to you.